When you're discharged from the hospital and you go home, the Visiting Nurse Association will come to your house. This will include both nursing care and physical therapy. That will start the day after you get home. And they will come as long as you need them. So in the beginning, it will be every other day, but as you progress, they will come every third day, every fourth day, to the point where you don't need them. And once you can drive your car, you can go to outpatient physical therapy. When you're in a hospital, the therapist will teach you how to walk with crutches or a walker. When you get home, the therapist will work on increasing the motion in the joint, increasing the strength, decreasing the swelling, decreasing the pain, and as you advance with those modalities, you'll get to the point where you'll move from 2 crutches to 1, or from 1 crutch to a cane, to eventually not requiring any assistance walking at all. Home therapy can be continued for any patient who's housebound, but once you reach the point that you can get out of your house and get to a outpatient physical therapist, it's very advantageous because they have more equipment and more therapy disciplines that they can put you through to enhance your recovery. When the physical therapist arrives at your house, they assess your living situation and make sure it's a safe environment for you. So if there are any electrical cords running across the floor or a rug that might slip, they remove those. They encourage you to wear rubber-soled shoes. They widen your doorways and pathways. They inspect your bathroom and make sure it's easily accessible. Bathtubs non-slip, and if necessary, recommend handrails. After total joint replacement surgery, the total hip replacement patients don't need physical therapy very long. They very quickly get the motion in their hip joint. Once they are independent with crutches or a walker, they really don't need much help. The total knee patients are a different population, and they need a lot of help on working their motion in their knee. So they'll need therapy a bit longer.